The original concept of motivational interviewing was created by William Miller and Stephen Rolnick in 1969 as a tool for drug and alcohol counseling. This technique draws influence from both patient-centered psychotherapy and cognitive behavioral therapy. Key concepts adopted included emphasis on the power of reflection and analysis of self-perception, as well as a strong belief in the patient's own ability to find solutions themselves through guided discussion. In addition to use for drug and alcohol counseling, many medical professions have now adopted this approach. For physical therapists, this technique is especially helpful for highly anxious patients or those with maladaptive pain behaviors.
Motivational interviewing is an evidence-based approach to patient care in which therapist, PT and/or PTA, and patient work in a mutually respectful and collaborative manner to promote patient motivation, self-efficacy, and commitment to goals. According to a recent article in the Academy of Orthopedic Physical Therapy, APTA, there are two main components of motivational interviewing spirit and motivational interviewing skills. The four elements of the motivational interviewing spirit include partnership, evocation, acceptance, and compassion. These describe the importance of respecting patient autonomy through acknowledging their strengths, imperfections, values, and thoughts about care to build a collaborative partnership and support intrinsic motivation by the patient to develop and obtain goals. Motivational interviewing skills are incorporated during treatment to further promote positive patient interactions. These include open-ended questions, in which the therapist seeks to avoid reflexive responses from the patient and instead facilitates bringing the patient down from a highly emotionally charged state by asking questions that encourage them to really think about their answer. Affirmations, in which the therapist acknowledges the strengths of the patient, such as the beneficial actions or values they exhibit in their therapy. Reflections, in which the therapist ensures the patient feels heard and validated by restating what the patient said in different words and verifying that it is correct. And summary, in which the therapist recognizes the barriers the patient is experiencing, while also reiterating the patient's therapy goals and the steps that the patient and therapist agree will assist the patient in reaching those goals.
Good morning, Janet.
Good morning.
So last visit we were talking about your exercise habits and utilizing the techniques in our session to address your symptoms of vertigo. How have those been going for you?
I'm having a hard time doing much of anything. I do my exercises from our sessions, but I get dizzy all the time, and I feel like I'm just not getting any better.
Yeah, that sounds like you're pretty frustrated and that it's hard to do the things that you want to do. What sort of activities have you tried since our last visit?
Well, this weekend I did some gardening with my son for about 3 hours. But every time I went to put the starts in the garden beds, I'd get dizzy. And then before that, I went for a walk with a friend of mine for like an hour, I want to say. But I just got really aggravated my knees. My knees really hurt.
Yeah, and being able to do things outside with your family seems like it's something that's very important for you. And I can see how it would be really upsetting to experience difficulty with that.
Yeah, I just feel like I'm getting worse. I'm not getting any better.
Okay. And that's understandably frustrating, Janet. But I do want to talk about your goals. So I know that when we started treatment a month ago, gardening and going for walks was part of your goals. Are you able to do any of those activities maybe better or longer with less symptoms than you could in the beginning when you really think back to when it started?
Yeah, I guess that's true. I can garden now, and I couldn't before, and walking's a lot easier now. I just get so frustrated when I get dizzy that I completely forget about the techniques that we talk about in therapy.
All right. Yeah, and that's good, though. I think that it's really important for you to acknowledge the progress that you've already made since you began treatment. So great job with that. And why don't we talk about things that could make these activities a little bit easier for you? What have you done in therapy that might help your dizziness and pain while working in the garden?
I know that using that spotting technique during therapy really helps calm down my dizziness.
Okay.
And also using the breathing and kind of focusing on the feeling of the ground in my feet really helps me not to focus on the pain in my knees and my dizziness. So I guess those could be helpful.
Yeah, those are all great strategies. And I think today we can discuss and practice how these techniques can more easily be carried over into those situations.
Okay, that sounds pretty good.
All right.